ब्रिटेन के स्लो इलाके तो मैंबर पार्लीमेंट तनमनजीत सिंह ढेसी वालों पार्लीमेंट विच NHS हस्पताल कार पार्किंग चार्जिस का मुद्दा चुकया गया। अते फिर उन्होंने वालों इसकी वकालत भी की गई कि यह कार पार्किंग चार्जिस नहीं लगाए जाने चाहिए। जी हाँ, तनमनजीत सिंह ढेसी के मुताबिक हस्पताल विच कोई भी अपनी खुशी नाल नहीं आता। जेकर उन्होंने कोई रिश्तेदार या फिर दोस्त दुख तकलीफ विच हस्पताल विच भर्ती है तां ही कोई हस्पताल विच आता है। इस तो इलावा उन्होंने कहा कि इस विच कोई शक नहीं कि हस्पतालों को फंड्स की जरूरत है, पर यह फंड्स लोगों तो वसूलने जायज़ नहीं।
For many, attending a hospital is a vulnerable time, whether seeking treatment for ourselves or for a loved one. Our hospitals are indeed underfunded and overstretched, but it is not for sick patients, anxious relatives and already hard-pressed NHS staff to be filling the funding gaps. We have heard that hospital car parking charges raise funds. However, many hospital trusts up and down our country have increased their charges without public consultation, the very people they are there for. Some trusts allow private contractors to manage car parking sites, leading to penalties and fines, as we've already heard within this important debate, for patients and visitors. At a time when the cost of living is increasing and those who work in the public sector have had their pay capped, the rising cost of hospital car parking increases the financial burden on many in our constituencies. Madam Deputy Speaker, it is not just the patients that are deterred by high charges. Family and friends may be discouraged from visiting patients at their bedside, which must surely have a negative impact on the mental well-being of the patient and lead to increased pressure on nursing staff. From personal experience, I know that many patients rely on relatives and friends to act as interpreters or advocates. Such elements are seemingly overlooked when surveys and reports are undertaken, but patient care can really be impacted where high charges deter people from providing this kind of crucial assistance. Yes, please.
Thank you. I just wanted to reflect upon the fact that we've heard a lot about staff, we've heard a lot about patients and their families. We did hear a reference from my honourable friend about volunteers, and you're talking about the importance of support for patients there. Would you agree with me that it is therefore particularly short-sighted of any hospital trust to seek to charge volunteers who give of their time to pay to park to do so?
I thank my honourable friend for his excellent intervention, and I couldn't agree with him more. I think in terms of volunteers, we've heard previously about volunteer drivers. It is just not fair. I think it's nonsensical to be asking them to dig further into their pockets. And indeed, when it comes to staff, hard-working staff who have gone for years without a decent pay rise also face this unfair and unnecessary burden. While some hospitals offer free or discounted parking, in relation to specific kinds of treatment or for people in receipt of specific benefits, there are significant variations in fees across trusts in the same region. Wexham Park Hospital in my Slough constituency has some of the highest parking charges in the region, £3.30 after the first 15 minutes, and an increase in stages to £8 over 5 hours. That is a situation in my constituency, but that trust is only doing what is being done, no doubt, by all other trusts and within the government's guidelines. What I do not want is for older and vulnerable patients to be deterred from attending a hospital. They should be able to get to their appointments in a comfortable, dignified, affordable manner and within a reasonable time. Madam Deputy Speaker, most NHS car parking charges have been abolished in Scotland and Wales, and I know the government has issued guidance to NHS trusts on the implementation of car parking charges, including the provision of discounted or free parking. These guidelines are not based in legislation and appear to have had little effect. Madam Deputy Speaker, the Labour government in 2010 left fully costed plans to phase out the charges for inpatients and their visitors. In 2015, indeed, a private member's bill gained cross-party support but was talked out. Clearly, many across the country and across the House want to see an end to hospital car parking charges. Let's send a clear message today that there is another way forward and that this unfair stealth tax on the vulnerable must end. Thank you very much.